Hi everyone. In this clip, I will talk a little bit about macular degeneration. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please ensure to consult your healthcare provider. Macular degeneration is an ailment that affects the macula, the central part of the retina responsible for sharp, detailed vision. There are two different types of macular degeneration. We have dry AMD, which is most common, between 85 to 90% of the patients. And in this, there is a gradual sort of thinning of macula and tiny yellow deposits form, which sort of progress slowly. Then we have the wet type, which is 10 to 15% of patients. And in this type, abnormal blood vessels grow under retina and leak fluid and blood. And this one causes faster and more sort of severe vision loss. Smoking doubles sort of the risk. Obesity, high blood pressure, cardiovascular disease, high-fat diet, which is low in antioxidants, are major causes of this ailment. I know because I have left out the two things that is always sort of referred to, the age-related and the family history, and that is simply because I don't believe in those two topics, as I have mentioned in many of my clips before, and for reasons. So, by the way, the acronym used for macular degeneration is AMD, and A stands for age-related. So conventional medicine does not have an outright cure, but treatments to slow down the progression and preserve vision. For example, for dry AMD, there is AREDS2 treatment supplements, which are used, and they're a combination of high-dose antioxidants, zinc, copper, lutein, zeaxanthin, to sort of reduce the progression in intermediate stages. However, if these nutrients are reducing progression, it stands the logic that they prevent it from happening. So hence, this is why age-related really does not make sense to me at all. Also, lifestyle changes such as quitting to smoke, eating leafy greens, omega-3 fatty acids, regular exercise. But when it comes to leafy greens, kale is an excellent source of both lutein and zeaxanthin, which are powerful antioxidants that help protect the body's tissues, particularly the eyes. And it protects it from damage and may reduce the risk of age-related sort of eye disease like cataracts and macular degeneration. Kale is considered a nutritional powerhouse and a top food source for these essential eye-protecting nutrients. Having a cup of steamed kale every day, every single day, religiously, has proven to delay the progression of macular degeneration. To help with wet AMD, they provide something called anti-VEGF injections. VEGF, or vascular endothelial growth factor, is a protein that stimulates the growth of new blood vessels. Anti-VEGF is a medication that blocks or slows down the action of this protein by preventing the growth of abnormal leaky blood vessels in the eye and reducing the vision loss. They also may do photodynamic therapy, which is drug plus cold laser sort of to destroy abnormal vessels, or thermal laser photocoagulation, which is less common actually nowadays. The nutritional supplements for macular degeneration include, as I mentioned, lutein and zeaxanthin in supplement form, also found in spinach, kale, corn, and eggs, omega-3 fatty acids in flax oil or fish oil, vitamin C, E, zinc, copper, and selenium, bilberry, eyebright, ginkgo biloba. These can be used as eye wash or in the form of supplement or tea. Acupuncture, which causes improved blood flow to the eye. Microcurrent stimulation, which is low-level electrical stimulation, sometimes used for retinal support. There's also traditional Chinese medicine, which may combine herbs that support circulation, reduce oxidative stress, and nourish the liver and kidneys because these organs are tied to the eyes. Of course, meditation, stress reduction, yoga, these all are helpful. On the emotional and metaphysical side of things, side of this ailment, common symbolic themes of macular degeneration are fear of the future, unwillingness to see what lies ahead. Since AMD affects central vision, it's often sort of interpreted as not wanting to look directly at something in life, or holding on to the past. Difficulty seeing the present clearly, avoidance or denial. The eyes are sort of refusing to acknowledge reality. Loss of joy or inspiration, inability to see the beauty in life. Eye disease may symbolically link to suppressed anger, frustration, or not seeing one's path. To heal the emotional side, we might want to cultivate trust in life's unfolding, practice acceptance of aging, change, and unknown. Allow suppressed emotions like fear, grief, and anger to sort of surface and be processed. Do visualization practices that will re-see the future with hope. Hope this has been helpful. Like and follow for more. Be the light.